I don't want to do it now. Okay, we'll call the Health Services Committee meeting to order. First, can I have a motion to accept the minutes of the previous meeting? Supervisor Gillian, Supervisor Bruno, all in favor?
Aye.
Do we have any public comments before we start? Privilege of the floor? Being none, Rob, would you like to lead us off? You'd be the leadoff hitter today.
Good morning. Okay, I just have one item. And this is a request to transfer 450,000 from unexpended fund balance. And again, this is related to the court ordered 730 CPL 730 competency examination restoration expenses. Unfortunately, I think everyone's aware, we've been hit particularly hard this year with these expenses. And we just need additional funds to continue to pay.
Okay, can I have a motion? Supervisor Bruno, Supervisor Gilligan, any questions? We all know that we have to pay it, so it doesn't really matter. Okay, all in favor?
Aye.
Opposed? All right.
That's really.
Oh, Rob, that was very nice of you.
Yeah. All right. Thank you very much. Enjoy the holidays, everyone.
Thank you, sir.
Thank you, Rob.
Ian, we'll have you next.
Thanks, Rob. Morning, everyone.
Morning.
Morning.
Ready to go?
I'm all set.
All right. The only item on our agenda is to transfer funds within the Hamilton County budget. We need to move $30,500 from the part-time budget code to the full-time budget code.
Okay, can I have a motion? Supervisor Thomas, Supervisor Runyon, any questions? All those in favor?
Aye.
Opposed?
And then just for an FYI, we had our senior picnic back in September. It went very well. We had over 250 seniors in attendance, which is 100 more than the previous year. So,
Wow.
yeah.
Did you know they were coming?
Yes, we knew. So we were ready. We had extra girls and everything.
Wow, that's great.
All I got.
Mr. Teflon, have a question?
Just a comment, since Dee is out here. Last night at the comprehensive plan public meeting, as a resident came up to me and expressed thanks for all the support she's gotten from the Office for the Aging. And just said the services are fantastic. And she gave me a couple names of people I'll pass those on to you, but great work. Thanks.
That's good to hear. And I'll definitely pass it along to the staff. They do a phenomenal job.
And I hear things with the Salvation Army with the meals is doing well.
Yeah, very well. Mhm.
Okay. Any other questions? All right, thanks, Dee.
Thank you.
I will wait for Janelle. She's on her way. Oh, good, aren't they? Yeah, we're live.
Sorry, Mr. Chair.
That's all right. Feel free to converse.
You know, he answers that phone the same way when I call. Exactly.
Still doing the ABC. No.
I used to like my phone actually. This Verizon one, it was solid. I'm gonna miss it now.
I was like, yeah, I don't really need all these. Everybody's so quiet.
Well, we were waiting for you.
We've updated one of our resolutions for transfer.
Thank you.
Does anybody need a packet?
What do you think? Here.
Get rid of that.
Thanks. Okay, you ready?
Yes,
Okay, first, before we start, congratulations on your 30th year of employment here at Warren County.
thank you.
Quite a milestone, and thank you for all you do.
Thank you. Or whatever you do. Good morning, everybody. Our first resolution request is to award WC 69-24 RFP for certified coding and OASIS services and authorize a contract with the lowest responsible proposer for the terms outlined in the RFP, which will be effective January 2025. Health Services utilizes a vendor for coding and chart review to ensure compliance with regulations and optimization of eligible revenue. Our current contract is expiring, so we need to have a new contract ready to go for January 2025. And we're in the process of reviewing the proposals that we've received. We received 4, and we're hopeful to have a recommendation at the meeting, which we're very close, but not quite ready.
Okay, can I have a motion, bring it to the floor? Supervisor Runyon. Supervisor Gilligan. Any questions?
Yes, just,
Okay.
could you just give an overview on what this coding, how it applies to your department and what it does for you?
So our revenues are based on our billing. And our billing at this current time is based on codes. So what we do is we go out and visit somebody. If they have 3 or 4 issues going on, there's a certain order of codes that you put them in. So the thought is you need to put them in the right order and then make sure that we have the right backup when we do the visit for the documentation to support our work on those codes. So this is kind of a third party that, number one, double checks our coding to make sure that we're optimizing revenue. And number two, making sure that we have the documentation to support that bill. So
This
that
is-
hopefully we're not doing fraudulent billing. It's kind of a safety net for that.
It's only for our home care division,
Okay.
not for the public health side. It's just the home care and the visits in the home.
That answers my question. Thank you.
Supervisor Bruno?
Could you tell, what's the anticipated cost of this?
So, in 2023, we spent around $31,000, actually 31,755. And so far this year, we've put in around 29,890, but we're anticipating that it'll be close to.
Probably 35,000.
Oh, it's close.
What this did is this replaced a person that we had years ago that retired, that was a full-time nurse,
Yeah.
came back per diem or part-time, I guess I should say. Her salary was pretty much the same. This way we saved money when we went to these guys because they're the experts. And also we didn't have to try to find somebody, and also we save on benefits and all that stuff by just utilizing this company.
The funds for this are in your budget?
Yes, yes, it is.
Thank you.
Okay, any other questions? All right, we'll call the question. All in favor?
Aye.
Opposed? Okay, carries.
Our second resolution request is to amend our health services home care therapist contract to reflect the attached updated rate schedule. Warren County is fortunate to have a small yet mighty therapy team that is dedicated to our profession and our agency, and most importantly, our patients. These therapists are second to none and provide excellent in-home care. With the implementation of electronic medical record, additional tasks and time have necessitated us to update our rate schedule to compensate for the extra time that's required for them to complete the task. The expenses related to these adjustments will increase our expenses by an estimated $5,500. And we feel that these additional expenses will be slightly offset by anticipated revenue. And we do have the money in our budget, I think, to absorb
Okay.
this, so I don't think it will cost.
Can I have a motion to bring this to the floor? Supervisor Runyon, second Supervisor Bruno. Any questions? Okay, call the question. All in favor?
Aye.
Opposed? Carries.
Thank you. This is a group that'll be appreciative. It's a very small step in the right direction. We had looked at actually raising the rates, and that was going to be well over $50,000 to do that based on our trends. So we thought at least trying to compensate for the things that weren't covered in the contracts would be a good place to start. Our resolution number 3 request is to amend the 2024 budget to adjust the New York State Department of Health Public Health Infrastructure Grant to reflect our third year funding in the amount of $110,565 that will become available to us December 1st of 2024.
Okay, call the question.
Need a motion?
Need a motion. Yeah. Supervisor Bruno, Supervisor Runyon. Okay, now any questions? Supervisor Patrick.
Essentially, we're just acknowledging the $110,000 and marking it as a revenue in our budget.
And an expense. We have the expense line of we're getting furniture. So we've been doing that. We're getting this much every year for 5 years. So it started December 1st, so we had to come to this meeting so we can get it in the budget for 2024, and then it'll carry over to 2025.
That's clear. Thank you.
Okay, any other questions? All right, now we'll call the question. All in favor?
Aye.
Opposed? Okay, carries.
All right, resolution request number 4, this is the new attachment that I just gave you this morning that Ton fixed. This is to transfer funds in our 2024 budget related to our public health infrastructure grant. And Ton, since there were changes, do you want to review that?
We had, when we got the infrastructure grant and initially, but over the summer, when one grant ended, we decided we could utilize some of our employees full-time from July to the end of November when this first grant. And so, we needed to just move money. We only had 18,000 in there. And with these 3 employees, we're able to utilize all their salary and their fringe into this grant, so I need to move money into salaries.
Okay. Bring it to the floor, Supervisor Runyon, Supervisor Gilligan, any questions? Okay, all those in favor?
Aye.
Opposed? Okay, carries.
Great, and under discussion items, we have our report of revenues and expenditures and also the comparison report that Tom is here to review.
So attachment number 5, which is our expenses as of November 6th is when I ran this. We'll give you an idea of where we stand. Always like to look at the payroll issue with where we stand compared to budget. We're at 62.55% as of then. And this time last year, we were at 71% of the budget. So we're doing well. Bottom line is our revenues, we are still in the middle. We are closing actually today, our October, for our home care, and all our grants will be eventually put in there for the quarter that we just finished. Our comparison, which is attachment number 6, again, the same thing, just to give you an idea, even though you're seeing salaries up, it's because of increases, but part-time salaries are down because of, obviously, we're not utilizing the people that we used to utilize for a lot of the grants that we haven't had to do and for COVID, what do I would say, immunizations and stuff like that, that we had to use people, call a lot of people in. And that's our comparison, nothing real big right now.
Does anybody else have any questions for on and, I have one. I was looking at the rabies report. Is this normal to have this many cases in a year? Well, like 19, what, do we know the areas that this stuff happens in? And I mean, that just seems,
Well, to be
costly.
clear, these are animal bites, not rabies cases.
Oh,
We
okay.
don't want to see rabies cases.
I was gonna say, that was extremely high.
But we have had such an increase. We have had a lot of bites for patients that have had to go to the hospital. And like I said last time, we've had many tours, because we are a tourist area, who come into our area and then they go home and get treatment. We've had to deal with Hawaii, we've had to deal with Las Vegas, we've had to deal with Texas, with New Jersey. So it's been cumbersome, to say the least. Like we said, during COVID, people were out and about. It seems like since people are out more now, and now we're seeing, definitely, it's been since I've been here this year, regarding patients has been the biggest regarding treatment.
The squirrel.
The squirrels, yeah, those are vicious this year.
They don't-
Okay, does anybody else have any questions for the girls? Anything from the public? Being none, do I have I'm sorry, Janelle.
I was just gonna say, in addition to all the normal attachments that we have, I was on vacation last week and I came back to a very nice letter on my desk. It was written by one of our families, and I thought, since you always hear about all the business side of home care, maybe you'd like to hear a note that I got. It said, "Dear Miss Jones, we want to thank you and your team for the excellent services provided by the physical therapist and nursing services. I especially want to mention Craig Bregg's treatment and concern of my patient's health. It was very impressive. We appreciate how your team got right on board as soon as the patient was released from the hospital. The Warren County bag of supplies came in handy too, especially the blood pressure digital gadget. When someone comes home from the hospital, there is so much to do and it's quite overwhelming. The bag and supplies sure did help. Again, our sincere thanks to you as director and to the staff of Warren County Health Services. Craig Briggs, has been recognized as Employee of the Month, and he's been one of our long-term nurses, and our physical therapists are also recognized here. So
Good,
I think
great.
our staff does an amazing job each and every day, and this is a testament of that.
And I think also, because you were saying, they mentioned the bags that we gave out, it came from Office for the Aging when they got a grant last year. And they gave to our home care to give to those that qualify, and they bring them out to them when they need them. So it's got a blood pressure blood pressure machine, a pulse oximeter, a notebook to keep track of all that stuff. So it's really been very helpful for the patients,
Great.
and at no cost to any of us. It helps the patients.
Well, thank you for sharing that with us. Do you have anything else? Okay, we'll go to privilege of the floor. Anybody have anything they would like to address the board with? Seeing none, motion for adjournment. Supervisor Bruno, Supervisor Patchett, all those in favor?
Aye.
Opposed? Thank you. Oh. Do you have something you want to say?
Sure, no,